Okay, welcome back to another episode of the Say How Is podcast. I am solo hosting today, but I'm joined by two pretty cool guests. And we've gone over their titles about 4 or 5 times before this went live. So there's a high chance of me forgetting. And trying to say them, getting them wrong is high. So, Carys, thank you for joining me. Please do share what your title is because I am going to get it wrong.
No problem. Thank you for your invite, and it's a pleasure to be on the podcast today. I'm Carys Allen. I'm the Deputy Lead Nurse Specialist in Cervical Screening Wales.
See, could you imagine if you've listened to this season and the last season, you know I would have got that wrong. And we are joined also by Georgina Wren. Please share your awesome title too.
I'm Dr. Georgina Wren. I'm a postdoctoral fellow in bowel cancer screening research, but I did my PhD in psychological medicine and behavioural genetics.
Like, how on earth would I have said all of that? But that's just because it's so cool that you guys are just doing really cool shit. Thank you so much for joining me. As we do every episode, we always speak so much before the episode starts. And I was like, guys, stop. This is all such good conversation for the pod. So how what we were saying earlier is how the three of us kind of connected. We go back 2 years now. Okay. So we put out a question on the podcast right before we started, Say How It Is, and we said if there's any episodes or topics that people would love us to do an episode on, to let us know. And you messaged us, didn't you?
Yeah.
And you said that, you told us your reason why, and I'll let you say that, but you said, I'd really appreciate if you could do this episode. And ever since, I've just been like, right, we are doing this episode.
Yeah.
And it's taken 2 years, but it's really important that we got it right.
Yeah.
Obviously, then crossed paths with Carys last year. And again, we'll discuss that later on. But the two of you, I was like, these are the two people that are really important to do this episode. So I want to make sure that we do it right. And I'm so glad to finally get it done. So yeah. You obviously messaged us, and would you like to give a little bit of insight as to why this episode was important for us to do?
Yeah, I'm trying to think back to where I would have been when I messaged. I'm trying to think back when it was. So yeah, a couple of years ago. So I was diagnosed with cervical cancer when I was 24, so I'm 27 now, so about 3 years ago. So I think probably about the time I was maybe just been through treatment when we first messaged. So I was diagnosed in the February of 2020. 2023, let's say 2023. I can't remember the exact date.
Because I remember do you remember I came to Cardiff Uni and we seen each other then? Yeah. And I don't think we actually we didn't click for me then until after. I was like, oh, yeah, that's what that was.
Yeah, so we kind of crossed paths and stuff. But yeah, I think must have been, I want to say 2023. I can't remember the exact dates, but it was around that time. Then we crossed paths at Cardiff Uni, and there we are. Yeah.
And Carys, we crossed paths last year, didn't we? So I was part of a cervical screening campaign, and then asked to go on the radio to talk about it, and then Carys joined us due to your obviously experience in the field and your job, and then when we met and how knowledgeable you are, and I don't think you realise how knowledgeable you are, I learned so much, and I was like, this is the perfect person to add on to G's story. So yeah, thank you so much.
Thank you for the invite.
Do you mind giving a little bit of a background? Because obviously you said you're a deputy in cervical screening. I can't even remember the whole mouthful, but yeah, you have been a nurse for quite a few years now.
Yeah, I've been a nurse. I studied in Swansea University. I qualified as a nurse in 2009. Varied background, varying from neurosurgery, burns and plastics, forensic surgery, orthopaedics. I set up a service in a forensic unit, so I was the lead general nurse for inpatients in a clinic there, and I noticed there was a big gap in relation to women's health. So I reached out to Cervical Screening Wales.
Wow, did you?
And I asked, how can you support me? I was a practice nurse prior to that post, I should have said, sorry.
What does that mean, sorry?
So I worked in a GP surgery as a nurse, so my title was a practice nurse there. So that's where I got the skill and sort of qualification to become a smear taker then. So I moved on then to work in a clinic where there was inpatients, and like I say, I was the lead nurse for general nurse for that clinic, and there was 10 ladies there, and there was no sort of service for women's health or promotion of women's health within that clinic. So I reached out to Public Health Wales Cervical Screening and asked, how can you support me with promoting women's health? So now she is my line manager, but she came out to visit and she, vetted the area, made sure it was fit for purpose. She reviewed all the policies that I wrote and supported the implementation of cervical screening within that clinic. And yeah, she said to me, do you realise that there's a job going with us at cervical screening? And of course, the rest is history. That's where I work.
So you mentioned that because of the where female health was at that stage, just what made you want to get more involved with cervical screening. So what were the reasons and what was your concerns around where female health was and the research around it to why you wanted to become a cervical screening nurse?
I just feel that there's lots of myths and maybe misunderstandings in relation to screening services that there are for women and people with a cervix. And I realised that usually that as women, we are prioritising other things potentially, general life, kids, work, those other things. And we kind of put it down to the bottom of the list, and I just thought, well, actually, how can I promote this? How can I support raising awareness, busting those myths, and sort of, sharing the importance of promoting women's health. Yes, it could be at the bottom of your list, but remember, if you don't look after yourself, then the rest doesn't follow.
So how old were you at that stage where you were investing time into, the cervical screening route that you went down? And had you had many smears yourself at that stage?
So, true story. As
we all like truth on this podcast.
I was working as a nurse in the hospitals, and anyway, I was invited for my first ever screening test. I went along, and after that, then because of genuinely embarrassment and I think lack of understanding, I'm ashamed to say I didn't go for 5 years. And I was actually a registered nurse, not doing that. So there was a gap of 5 years. And then, of course, I felt that I'd done a disservice to myself and to others. And I felt that there was a big gap that I needed to. The biggest problem is I was thinking in my mind, again, back to those myths and lack of awareness and lack of understanding, even on my part, was there's no symptoms, therefore there's no problems. That's why that long period lapsed. And felt that women's health was important. I felt there's a big gap within, like you say, that education part. And that's when I thought I need to get involved in this. And that's where my career took me.
So, you mentioned that you were 24 when you got diagnosed. And Carys, correct me if I'm wrong. I don't want to be wrong, but correct me if I'm wrong. 25 is the age where you start receiving your... that's the age you are when you start getting screening?
The invitation for cervical screening goes out to 24 and a half.
Right.
How old was you, Georgina?
24 and a half.
There we are. So when you have your first invitation and it ends at 64.
Right. So... what was your kind of process as to how you then got diagnosed? Because if you found out you had it at 24, that was obviously before you'd get your screening.
Yeah. So I got my letter when I was 24 and a half in the February, and I think I booked it within a week, and they said, we've got a slot, with a GP practice nurse the next week or 10 days later. And I didn't think anything of it. I've got, a research background in women's health, and I'm super sort of happy to, I've got no qualms about it. And I think all my friends know that I'm the person to come to talk anything about women's health and anything.
I'm glad we're getting to know each other. I'll be message you hi.
Yeah, exactly. All my friends know I am that person. That I've got absolutely no shame. I'll talk about it wherever. I'm more happy to talk about it. So to me, it wasn't a big thing. It was just part of what I knew. And this was the February of 2023, and then I had my my test literally in the GP surgery, and there were some issues with the test, and she basically said, I don't think it's a very good sample, you probably have to have it again, don't be surprised if you get a letter saying you probably have to have another sample. Again, literally didn't think anything of it, went back to work, didn't think twice, and then I got a letter saying, what I thought the letter was going to be was, the sample's not good enough.
Yeah.
We'll go back. And they said, oh no, you've got high grade abnormal, HPV, a lot of HPV, but also high grade abnormal changes. But it's my first ever smear test. So it's important to note that prior to this, I had 0 symptoms, like no symptoms whatsoever. Like,
sorry to interrupt halfway through. Can you just, people listening, what symptoms would you expect to have, if that makes sense?
I mean, Carys, you can definitely jump in as well. But
That's fine.
stuff like a change in discharge, things like any abdominal pain, bleeding, pain while having sex.
And this is to have HPV, or is this for cervical cancer?
So we say sort of our main things in regards to symptoms is bleeding in between periods, bleeding postmenopausally, any unusual vaginal discharge, bleeding after intercourse. Yeah. Those are the main sort of points. And like you say, anything that's unusual for you, like you just mentioned there, abdominal pain, backache, those kind of things. So just to add, if you do have any of those, experiencing any of those symptoms, it may not be appropriate to have a smear test. But what's really important is that you actually go to the surgery, your GP surgery, and have that discussion with the practice nurse or doctor. They won't necessarily do a cervical screening test because a cervical screening test is a screening tool. It's not diagnostic in nature. And maybe it's not you haven't been invited. So, of course, it's inappropriate to take a test at that point. So what's really important, if you do have those symptoms, you go and you seek that advice then from your nurse or doctor.
So then you had the letter where it said your levels, as you mentioned there, it's not a diagnosis, it's just informing you that your levels. So what happened then after that? Because did it say in the letter that you received the letter that your levels were abnormal, or was it like contact us and then they told you?
So it said that I had, I can't remember the exact wording, it's something along the lines of high grade abnormal changes, am I right in saying that?
Yeah.
HPV, so it said that I had a colposcopy booked, I think it was for, let's say, 2 weeks later.
And what's a coloscopy, sorry?
Colposcopy.
Flipping heck, man. Flipping heck. English lessons with Ffion, Lewis. Booked, yeah.
Yeah, so they booked it, and so the whole oh no, I'm getting them confused. It's because I talk about colonoscopies for work.
They're very similar.
Bowel, and then I talk about colposcopies for cervix. So colonoscopy is
you had that book.
Colposcopy.
And what is that?
So it's when they're going to go in, and I'm going to say it in layman's terms. You definitely say it in more medical terms than me. So and they go in and basically remove those cells that could potentially become cancerous. So it's like the removal of the cells before they turn into cancer. Is that a good explanation of it?
Yeah, definitely. So a cervical screening test, as we mentioned, is a screening tool. It's not diagnostic in nature. It's designed to look for changes. So initially we look for the presence or the absence of the human papilloma virus, and we call it HPV. Yeah, HPV for short. HPV is as common as the common cold. Most of us will get it at some point during our life. The stat is about 80% of people, that's both men and women, will come into contact with this virus at some point. It has no symptoms. Right. It is picked up through intimate skin-to-skin contact, and that's how the virus is transmitted. But you don't necessarily have to have penetrative sex in order to come into contact with the virus. But once you do, that's how it tends to get into the vaginal tissue and the cervix. But this virus can be passed on with things such as using shade sex toys or digital sex, which is using fingers. So there's methods in which it can be passed on. We initially look for the virus because we know what the potential the virus has. So there's 2 types of the virus, and we group them into high risk and low risk types. So the low risk types, we don't look for low risk types of HPV because we know that the low risk types of HPV are not associated with cell changes that can potentially occur on the cervix. We only look for high risk types of HPV because research and evidence supports that high risk HPV has the potential to change the cells on the cervix.
Right.
So the smear test, when you go for a smear test, the nurse or the doctor performing the test will check the health of the cervix. They will take that sample gets sent away to the lab will initially look for HPV, but only high-risk types of HPV. If HPV is found, then they'll go on to check the cells from that sample then, and if there are any cell changes whatsoever, then that individual will be referred into the colposcopy department.
I see. And that's what happened in G's case now, yeah.
Yeah, but it is important to note that you can have HPV and no cell changes whatsoever. But if you have a result that shows HPV is present, but your cells are perfectly normal, what we'll ask is that you come back in a year. Because this virus comes and goes, like I say, it behaves like a common cold. It's transient, what we call transient, you know. So you could have HPV on your one test, but next time you go for a test, it could go. It just is cleared through your own immune system. So it's really important to have a strong, healthy immune system. Things like eating well, sleeping well, maintaining a healthy lifestyle. What's really important is that you go for screening when you're cold, but not necessarily just picking up from what G was saying that it's, you know, likely that you will not have symptoms.
So you had your
colposcopy. Fill in the blanks.
Yeah, thank you very much. What happened then?
So I'll say the short version of the long story. So
It's all right.
it's a long one. So I had my colposcopy and with I think is the most amazing consultant ever, and he effectively he did the colposcopy, and I did not think anything at the time. So we were in what I can only describe as the hottest sauna-like room in the hospital.
Like this one.
Absolutely. Like if anyone knows, you know, the hospital in Cardiff, it is always heating is on 24/7. So we're in the most boiling room, and he had a mask on, and he did the colposcopy, and he said it would be about 10-15 minutes. So I didn't think anything of it, but it's important to note. So I had local anaesthetic in my service, but I also had gas and air.
Really?
And so I sort of was, not out of it, but sort of, not really paying much attention. And my partner was there, and there was a nurse chaperone there as well, who was absolutely amazing. Anyway, he did it, and I didn't really realise at the time. He was probably there for about 40 minutes. And I, at the time, genuinely, gas and air is a brilliant thing, isn't it? Everyone knows it's great. So I sort of didn't think anything of it. I got up, I went to go and get changed in a gown, so I went to go put my clothes back on, and he came back and he asked if he could take his mask down, and I thought it was just because he was done with the sterile part of the procedure and it was very warm. He opened a window and he basically said, I couldn't do the colposcopy. I've taken a biopsy because we think that we can see you've got a tumour and we think it's cancerous. And my partner said, and I'm quite a polite person, my partner said, in that moment, it was the most polite I've ever seen you, and all you said was, okay, thanks. And he just said, do you understand what I've said? Like, can you process it? And I just kept saying, yeah, okay, thanks. I just had this blank look on my face.
Didn't register.
Yeah. And the only reason I can recall this is because my partner can recall it, and I just had no real memory of it. They just said they were going to send the biopsy off. Didn't know anything from there. So didn't know. So for 2 weeks, I had a little leaflet from Macmillan, and I didn't know anything. I didn't know the stage. Nothing really.
How was that? How did you process that? Like, obviously, once gas and air left your system, like, how did you process that when you had to wait those 2 weeks? That must have felt like years waiting rather than 2 weeks. Do you know what I mean?
Yeah, it was a long time. So when it initially happened, I walked out and didn't really think anything of it. And again, just the classic, that all the toilets were occupied or broken. In pretty much the whole of the hospital, it appeared. So I went into one of the toilets I could find, and it was like a scene from a movie. I just was like on the floor crying. It was just really awful. And thank goodness my partner was there. And then a student doctor walked in. The student doctor, who must see all sorts every single day, just looked at me and thought, which must have thought, I've just come to the toilet, a little break, and you're on the floor crying. So
but you completely in your right to be emotional.
Yeah, it was pretty rough. So I didn't tell anyone for 2 weeks. I told my partner. Obviously, my partner was there. I told my mum and 2 friends. I didn't tell anyone else. And I suppose
you were unknown then, were you? Because you were just waiting to.
100%. You don't know the stage. You don't know anything about it. People ask questions. You can't answer them. So I chose not to keep it private for 2 weeks. And then after that, went back, and then it sort of started the process of. He then knew, having done the biopsy, obviously being back from the lab, he knew what stage it was. He knew, obviously, he confirmed that it was cervical cancer, which obviously kind of needs confirming through that biopsy. So it was, and I think I was honestly in shock for probably the whole 2 weeks, to the point that, and this sounds wild when I say that out loud, the day after my biopsy, so I had the biopsy about 3:00 on the Tuesday.
And that's 2 weeks later.
So no, this is at the colposcopy. So at the colposcopy on the Tuesday, had the biopsy on the Tuesday, and they advised not to do anything, pretty pretty intense, anything, heavy lifting or intense activity. And I honestly was in shock, and it wasn't really a choice. We had a pretty significant semi-final for rugby on the Wednesday.
Shock that rugby takes over,
Classic. And I just thought there's absolutely no way, having worked for all this time, there's a way to get up into the next league, that I would not be there. So I put on the most amount of padding possibly, like a pad, period underwear. I had 2 undershorts on and my shorts, and by the end of the match, I still bled through all of that. And I wouldn't advise that to anyone. And I think it was a poor decision, but in that moment I was just in so much shock, and I just wanted to play, and I in my head thought this might be my last game. I didn't know what stage it was. I didn't know anything. So for me, that was sort of just a coping mechanism. Yeah. And then from then on, it just went on in terms of all the rest of the treatment. So
I can completely understand why you're in that mindset, though. Obviously never experienced what you have, but like you said, even if you hadn't, say for example that biopsy was 2 days later, 2 days after, you still would have played in that game. 100%. So it's really difficult to then be you said, you're in the unknown, you're in that window where you don't know what it's going to be like. You said how severe it's going to be. So I probably would have done exactly the same thing. And it was easy to say not being in it, but especially, if anyone's listening has a purpose or is involved in a sport that they use as an out, or use as something that's kind of distracting. Yeah, I probably literally would have done exactly the same thing.
Yeah, I did
wrapped
it
up like a mummy.
Yeah, I didn't know I had
choice. I can understand that. So, Carys, from the biopsy perspective, when it takes 2 weeks, is that because it takes that long then to test the cells? Is that correct?
Yeah, absolutely. So I actually am a nurse colposcopist myself. So you undertake, as G was saying, the colposcopy examination, and you have to take a biopsy because that's how you diagnose. So it gets sent away to a lab for further analysis, and of course they're able then to diagnose from that piece of tissue. You can't diagnose from a smear test. A smear test is only a suspicion of change. That's why it's screening. But colposcopy is what we class as diagnostic, but you do need that professional examination and of course that biopsy for that accurate diagnosis then, so you can move on to the next phase then of management, treatment, etc.
So what was next for you then? You played that game.
Yeah. And I remember finishing the game and I was crying, thinking, I was also quite upset and everything. And we'd won, just for
and
context.
For context, you also said you hadn't told anyone other than 2 people.
No. And obviously I'm crying, and the only person who knows is my partner, who's bringing on Lucozade because I felt so unwell. And all the girls are like, oh, you must be so happy we've won. I'm crying. And I was like, oh, I know, it's such an emotional day. I was thinking, if only you.
Oh, I wish I could give you a hug.
I know. It was just so it was so out of body. So yeah, then I found out after 2 weeks, and he told me that it was sort of the last stage of stage 1, which sounds silly, but within stage 1 there's small stages, so stage 1B2 and stage 1, there's all different bits. So that was the end of stage 1, and he just said that probably the best option, laid out all the options, that probably the best option would have been a radical hysterectomy, and gave me some time to think about it, and we had a chat, and there was discussions around whether I was going to freeze my eggs, and there was all sorts of discussions that you never think you'd have to sort of chat about at 24.
That is actually crazy.
Yeah, it was wild. And
having you're in uni and you're thinking, I've got to make a decision whether I want to have kids or not.
Yeah, and it was the most wild decision. And I remember so we had 2 weeks. So once he decided, he said, we'll have an appointment in 2 weeks, in which we'll get a provisional surgery date and we'll prepare things if you do want to go ahead with it. So I came back after the next 2 weeks, and he said, have you decided, whether you want to freeze your eggs? And I said, yeah, we've kind of decided for a multitude of reasons that it isn't right for us. And we've discussed having children before, so this wasn't totally new to us as a couple, and we were like, okay, actually it wasn't right for us. And he said, we actually have found out through the MRI that I'd since had that the tumour was probably a bit too big for that at that point.
Too big for what?
So
Sorry.
to freeze the eggs. So he said it probably wouldn't be particularly feasible if I did want to go ahead with that. So I was a bit like, okay, well, glad I've decided not to.
Oh my God. So not only had you to process the fact that you had this tumour, and then if you did want to freeze your eggs, and that then decision was taken away from you as well.
Yeah, it was quite it was a bit of a, and I was glad I'd made that decision. I was really comfortable with that decision, as comfortable as you can be in that moment. So yeah, I decided that, and then we had a surgery date, which was April 20th, I think, 2023. So between my smear test, which was February 20th, and my surgery was April 20th. So it was exactly 2 months.
Whoa, that's quite a quick turnaround.
Yeah. So they were like, this is probably going to be the best thing. And like, you know, I'd put total trust, and I think he's, you know, and a brilliant consultant. I just put total trust in him, and that was what was going to happen. And it sort of, then you put things in place in terms of work and, you know, what you're going to have to, you know, someone looking after you afterwards and all that sort of stuff. So you then start to put things in place, you start to do a bit more of the processing, but you very much go into practical. I didn't have much space for emotional at that point. I just thought, every day is waiting to the surgery. So yeah, I had the surgery in April the 20th, I think it was, the weekend before I played in the Principality.
The weekend before?
Yeah, I know.
What?
I know. So I played in the Principality.
A week later? Are you joking?
Yeah, so I played the weekend before I played in the Principality. So I think I had the Principality on a Saturday, I think it was, and I had my surgery the next Wednesday. So I think it was 5 days.
Whoa!
I know. But I remember saying to him, there's no way my surgery can be before, let's say April 15th, I can't remember the exact date. But I said to him, there's absolutely no way it can be before April 15th. I need to make this very clear. And he was like, you do? And I said, there's no sort of room for negotiation. I must be in the Principality.
Oh, I need you to play?
Yeah, I played, yeah.
Okay. I can't understand. I think it puts things into perspective, I'd imagine. Yeah. And I think, like, it sounds like obviously very passionate about rugby, and if for whatever reason the outcome could have potentially been negative, I suppose you didn't want to look back on that and be like, well, that's a memory I would have really liked to cherish.
Yeah, and all the girls knew how important it was to me, and all the girls
they knew at that point.
Yes, everyone knew what my surgery date was, and like, you know, both the universities. This is the club team I play for, and they're absolutely incredible. And they, you know, they just were so supportive, and they knew in that moment how important it was to me. So that was, you know, it was a non-negotiable to me. So yeah, played the Principality. So
Carys, just obviously, G mentioned that the tumour was too big to then have her eggs frozen. Like, why is that? Like, why would the tumour prevent that from happening?
If I'm honest with you, I'm not quite sure.
Yeah, no, that's fine.
What you know, what the reasons would be behind that.
Yeah,
that would be something that definitely would need to be discussed with a consultant, as obviously you did, isn't it? You know, so
then your role then would be everything leading up to the consultant, and then the consultant then would take over from, like, if the cells have been confirmed that they're cancerous.
Yes, so they would. Yeah. So, but that's why you have to have that MRI, isn't it? The importance of literally that imaging, of looking, you know, because we're limited on what we can see. So the MRI tells us a lot more, and that's why it's so important that those investigations are taking place beforehand.
So how did you end up telling everybody? Because obviously originally you said in that 2-week period that you didn't tell anyone. Then what was that? What was that process like for you? Did you find that really difficult?
Yeah, I'll be honest, I can't remember a lot of it. I think because it's just like a
bit of a blur.
Yeah, it is a bit of a blur. But I remember calling people, and I very much told people individually, and I would like go up to people and say, you know, call people, or people who you know who weren't based in Cardiff. I'd go and you know, call them or FaceTime and stuff. And that is a really hard conversation to have. You know, that's like, how do you tell, you know, your close family? How do you tell your close friends, you know, the people you're close in your life, that this is something, you know, and you don't know 100% the answers to their questions. You know, their questions are you going to be okay? You know, will the surgery do everything? You know, you don't know the answer to your questions 100%. And the clinical nurse specialists in the unit and the gynae oncology unit in the hospital are absolutely incredible. So any questions I had, I would just go back to them and call them and say, I don't know the answer, and they'd obviously offer. It was really difficult. Like, and you know, it's things. So I lost my auntie, who's also my godmother, when I was about 12 to breast cancer, and there's actually no genetic connection at all. Yeah, there's literally no genetic connection in the way, because she had genetic testing, so it's actually completely coincidental in a way, and that was, I think, the most difficult thing I found was telling my grandparents, because they'd lost their daughter, and then to find out from their granddaughter, that was probably the worst. I don't think I actually ended up telling them. I think my mum to tell them, because I thought, how do you tell your grandparents that not only have they lost their daughter to cancer, they potentially could lose their granddaughter, and that was very difficult.
I can only imagine. And then also, you're probably, correct me if I'm wrong, but you're probably thinking about everyone else's feelings and reactions. And actually, did you take time for your own feelings? Because I know you said it was a bit of a blur, and I can imagine, you're in survival mode, thinking about, like you said, you're thinking practically, but did you ever find yourself taking time to process your own feelings?
I'd say no, in all honesty. Like, I think it's really hard in that moment. And people, I think I've heard a lot of people who have cancer who say this really regularly, is that you just go to the next step. What is the next thing you have to do? What is the next stage? What is the next appointment? You just make it through to the next day and the next appointment. And I don't think I started to emotionally process it probably till maybe like the August, beyond that, because after my surgery, I had chemotherapy and radiotherapy. Right. So after I'd had all that treatment, I then was like, I can maybe start to process in a way. So yeah, I definitely didn't start processing till later on.
So you had the surgery. Yeah. How soon after did your therapy start happening?
So I didn't know I had to have it. They thought that would be it.
Really?
Yeah. So about 6 to 8 weeks after my surgery, I had as a result of the surgery, they basically said that they thought that the tumour was contained, but actually it started to, in a very minor way, started to spread a little bit into some lymphatic cells and some like nervous system cells. So it wasn't like into my nervous system or my lymphatic system, but it had started in very, very small ways to migrate. So they said I basically had a choice, and that it could go either way. These cells could never turn into anything, and that I could go the rest of my life and I could be fine, or these cells could then become something additional in the future. So that was another kind of conversation. They then referred me to Ffion Cancer Centre instead of being at the Heath. So yeah, I then was moved over care, and they said it's up to you, whether you want to, but that will sort of be the, that will make sure in a way that there won't be anything to the best of their ability. So I just said, well, I know that I would live with regret for the rest of my life, that if I didn't, I knew that it was 100% what I needed to do. So I started chemotherapy in the June, end of the June.
Are you still 24 at this point?
I turned 25 in the May. Whoa. So I'd been 25 for like a month.
And then you're starting chemo?
Yeah, so then I had chemo. So I had 6 weeks of chemotherapy. I had 25 sessions of external radiotherapy, and I had 5 sessions of internal radiotherapy. So then I finished that in the August.
I can't believe how tough that must have been.
Yeah, it was a wild. I thought the surgery would by far and large be the largest part of it. To lose to lose your womb, to lose like an organ, and to lose all of that, and that's I found a huge amount of grief around all that process. I thought that would be the most difficult bit, but that was difficult in a different way than the chemo and the radiotherapy was. Like,
I suppose,
wild.
Was it difficult because then it was taking a choice away from you?
Yeah,
for later life, because you had those conversations with your partner, but then
definitely,
you then lose your womb, like
and you're suddenly like, and there's a whole other part of cancer that I think is not talked about enough, which is all the things like the early menopause. Like, you suddenly aren't in menopause, and the next day you're in menopause, and that happened as a result of my radiotherapy and my chemotherapy. So like all those things, or all the symptoms. Like, I had really, really bad lymphedema as a result of my surgery. I had quite a lot of post-op complications. I had a really difficult. I had a hernia and I had a hernia and a bowel obstruction. So I had emergencies, basically life-changing surgery, life-saving surgery in the October as well. So
life-saving surgery.
Yeah, I was really, really ill, very all of a sudden.
But because of the result of
radiotherapy, because it had like weakened my abdominal wall, and it's all these like additional things, and I talk about that like really flippantly.
Yeah, you did just naturally just say, "Oh, it's life-saving surgery." I was like, "What?"
Yeah.
Sorry, can you repeat that?
Yeah. It was like
it's like when you said to the consultant, "Thank you."
Yeah.
Goodness. Yeah. But I suppose, again, I've never been through anything like you have, but I suppose in my head, if I'd tried to think of how I would feel if I was in that position, I suppose you just like survival. You're in survival mode. You're in fight mode. It's just something else that you just need to
100%.
get over. With someone on the outside, like me hearing that, I'm like, girl, do you know what you just said?
Yeah, I know. And when I talk about it, and like I've done lots of media stuff with Cancer Research UK and lots of different stuff, and like I've been really like fortunate and like in sharing a lot of my story and stuff, and I think potentially I'm a little bit numb to it, but also I just think like absolute credit to the NHS and a lot of charities. I've had a lot of like counselling and therapy and a lot of like emotional and psychological support since, so I'm really lucky to have had that. So it's taken a lot to me to get to the point that I am as like neutral, and when I talk about it now, but if you talked to me about it when it first happened, I obviously wouldn't be able to talk about it like this. So yeah, it takes a long time.
100%, and you're only human at the end of the day.
Yeah.
To then have to process quite a lot, and especially because you're at an age where you're in this transition period. You're, you know, coming up, like you're at that stage where you're kind of finishing uni. Like, and then this all gets thrown at you. Yeah. Like, Carys, how does it make you feel in the role that you are? Do you find, like, do you ever hear stories then? Do you meet people where, like G, for example, where you may have met someone where you then screened them and then had found cells that then gets passed on, and do you hear any of these stories with anyone that you meet?
Yeah, we use them. Yeah, hear a mixture of stories. So from people who've never been for screening at all, and when they do go for screening, unfortunately, we do find changes that you know we have to intervene, and then we find the opposite end of the scale, that whereby people do go for screening, similar to like G's story there, you know. And I think the bottom line here and the main message to get across, it'll save your life. Yeah. You know, whether it's the first time you ever go for screening, you know, and you've been invited and you're a bit apprehensive, you know, I think especially your in G story, please go for your screening, and it takes minutes, you know, and we are healthcare professionals. We are glad to see you come through the door to have that test.
Well, interesting question for both of you, especially Cash, you obviously mentioned that you were about 5 years until you had yours, but now, since you're both experienced, because you're obviously within your job and then obviously going through it medically yourself, what is your mindset around cervical screening now? Are you actively telling your friends, telling your family, do the people around you understand now more so how important it is because of both of your experiences in the field and then obviously going through it yourself?
I'll let you go first.
Yeah, definitely. A massive and big advocate, you know, not only professionally, but as a woman, you know, to go for screening is so essential, because, you know, like back to what I said at the beginning, no symptoms, no problems. And back to what G was saying, you didn't have any symptoms, you know, and we outlined what some of the symptoms could be. But HPV that causes the changes is symptomless. And I know G did mention it earlier on about sort of cervical changes then, and ultimately cervical cancer. It's not genetically linked. It is HPV that causes those changes. So if you are, for example, in school and offered the HPV vaccination, please take that vaccination. Fantastic. Take up that offer. It gives you protection against HPV. It's not the silver bullet whereby if you have the vaccine, you don't have to go for screening. It's still essential that you go for screening. It gives you protection, but it doesn't give you 100% protection at all.
Did you have it, G?
I honestly can't remember. And I got asked this before, I honestly cannot remember.
Because honestly, I naively didn't understand. I genuinely thought that cervical screening was a screening for cancer. I had no idea. And then I did a campaign and I learned. I was with a doctor and I learned so much. And she taught me it was HPV. And I was like, whoa, that's a massive missing thing that in my head I didn't understand. That
absolutely,
you're not testing for cancer. You're not screening for cancer. You're screening for HPV that can cause cancer. I think that's the big difference.
Definitely.
So if you do have HPV, say I went for my screening, I comes back, I have HPV, then what happens? What happens then? Like, do you take antibiotics? Do you not? Like, is there anything around that? Like, with a common cold, you dose up. Like, how does it work for HPV?
No problem. So HPV, I covered how it's transmitted, but there's no treatment. There's no sort of medication, antibiotics or anything you can take. HPV is cleared through your own immune system. So it's really important to have a strong, healthy immune system. You know, eating well, sleeping well, maintaining that healthy lifestyle, coming for screening when called. A risk factor is smoking. So those ladies who smoke are likely to have changes on the cervix, and this is related to the fact that they will find it difficult to clear the HPV virus because of the effects of the nicotine.
Whoa, that's really interesting.
Yeah, so smoking has a really big impact. Vaping, if it contains nicotine, it's in the same category, you know. So if you do smoke, just give consideration that you may find it harder to clear that virus. So yeah, like I say, the virus, there's no treatment, there's no cure, it clears through your own immune system.
So, G, go back to your story now. You said you had that surgery. What happened after that from your recovery perspective?
So the recovery...
From the last surgery?
So from the hernia or from the... hysterectomy.
The hernia.
So they went through the same scar as a hysterectomy. So it's just like a cesarean scar all the way across. So so I did a lot of physiotherapy. And I think that's one thing that I don't think is maybe talked about enough, is actually the real impact on your body. And I had I'm very open about, I've had NHS physios and other clinicians say there's absolutely no way you can go back to playing rugby at the level you're playing. And I don't really like the word no. So I
Preach, sister.
I said, okay, cool. Well, you're going to have to not lump it. So I just decided, I was like, there's, I know. So I went to, I paid privately to go to a really specialist women's health physio who's absolutely incredible. And she did a lot of work and supported me in getting back to rugby. And it's a major surgery, and then to go through the same scar twice, it took a lot of time to repair the scar and all that sort of thing. So after my hernia, I took a lot of time. So then I went back onto the pitch in end of March 2024.
Whoa!
Yeah. And
oh my God, that's not even a year from when you had your hysterectomy, right? Is that right?
Yeah,
you said
it
April
was
the 20th.
Yeah. So it felt like it had been 5 years.
So you've gone through all of that, and then less than a year you've gone on the field.
Yeah, and it was, and when I say that NHS physios said maybe, don't, it was things like, your bones become, there's a risk of your bones becoming less dense, automatically in early menopause. There's a lot of different things that kind of put me more at risk. Yeah. And so it wasn't just my scar. There was, I'm kind of underestimating it, but yeah, there was a lot of things. Yeah, I went back, and when I tell you the reception, that I got when I ran on that field, so I was on the bench and coming on, I honestly can't tell you, everyone who had been there throughout the rehab journey, our university physio, Ben, friends, family, partner, there was signs. The other team must have thought, who is this girl? Why does everyone think she's the bee's knees?
I love that though. That is so special.
It was so good. It was honestly one of the best days of my life to make it back there.
I was going to ask, how did that feel?
It was the best day, honestly the best day. And I just look at photos now of me on that day and stuff. I just think I know, and everyone else knows around me, how hard I worked in that rehab process to get back. It was so difficult to get back. There were definitely points where I thought, sack this off. This is a lot of rehab, a lot of time in the gym. So yeah, I didn't think I'd potentially get back there. So to actually be there, be in the room, but be on the pitch. Yeah. Was amazing. And I just think it is possible. And I just don't, I think it is possible to do. And they say I didn't really like the word no. So yeah, we did explain to the team who I was.
But I suppose that puts life into perspective though, no?
Oh yeah. Yeah, 100%. It is one of the biggest things, again, I hear from a lot of people with cancer, is it puts your life into perspective, and it puts your life, very sadly, my friend who I went through treatment with, really sadly, passed away a few months ago. And that really put a lot into perspective.
Did they have the same cancer?
So yeah, same cancer, same consultant, found it on the same day, had the same treatment, same chemo, same radio, and we had exactly the same day through absolutely everything. It was
similar
wild.
age?
No, she was actually in her 40s.
Right.
And she was in it's kind of not really my story to tell, but yeah, she then had secondary cancer and really sadly passed away. And I remember it was a funeral a few weeks ago, and it really puts your life into perspective. I feel so incredibly fortunate to be here, and it really, and people say, you don't want to moan about the traffic anymore, bigger things in life. Yeah, of course you still moan about the traffic.
Yeah, yes.
Of course I still moan about the traffic and the rain and whatever. But
if you broke a nail, you stubbed your toe.
Oh yeah, of course you do.
You're
Everyone
human.
does. So normal. Yeah. But what I don't moan about now is the ability to do things. Every day I'm in the gym, I'm just so grateful to be here every day. I don't care whether I'm on the bench or I'm starting, as long as I'm playing rugby. I think that is so important to not, and there are a lot of things that are still significant, still important, but it does completely change your perspective.
But I suppose in a different way, to be you want to experience different things. Yeah. I can imagine your mindset, just how your outlook is. Yes, you just said you will get pissed off about the goddamn traffic. However, your outlook on everything else, with your family, your friends, experiencing life, I suppose that becomes a lot more important in a different way. Yeah, you just change the perspective on things, and things become important in a different way. We're getting married this year in a couple of months' time, and Woo!
I know. Whoa. And, you know, when we were organising the wedding, we were like, do you know what? I don't care what anyone else wants. I don't care what anyone else wants.
You shouldn't, girl.
Honestly.
It's your goddamn wedding.
I'm paying for it.
No one's coming.
Exactly. It's actually just the two of us. You know, and it just becomes really nothing matters. And there's just becomes a real, and I wouldn't wish what's happened to me upon anybody. And that's why I'm so passionate about talking about it, because I just think like you don't know the value of things maybe until you see them possibly being taken away. Yeah. And I feel like so lucky, and that's why honestly I encourage everyone. And like, you know, you were saying earlier about whether you talk to your family and friends about screening, like I think all my friends might be slightly bored of me talking about it. I talk about it, and like that, you know, now I work in bowel cancer screening, I must use the word screening 40 times a day, you know, and everyone's like, we know, we're gonna go.
Did you tattoo on your forehead?
Yeah. She's screening.
Carys, what do you think is the reasons why people don't go for screening? Like, what kind of common reasons do you see?
Embarrassment has got to be up there, you know.
Or exposing themselves?
Absolutely. It's the most intimate examination a female will undergo, isn't it, you know? You have to undress in front of somebody you don't know. You're feeling vulnerable. Do you know what I mean? In that situation. But remember, we're all healthcare professionals. Like you said earlier, we're glad to see you coming through that door, and we will honestly give you the best service. You know, we'll reassure you, we'll support you in any shape, way or form that's needed. What's important is that you're there.
Yeah.
Yeah.
How was your relationship with your body during that time? Especially because you said you had 2 surgeries through the same scar. Like, did you... Because obviously I'd imagine you potentially could be thinking one thing to be like you've got to kind of have faith in your body to kind of fight you through it, but at the same time your body's changing so much and it's going through so much, and then it kind of a lot of changes would happen. So how was that for you during that process? Because as you mentioned, there's a lot of things that you go through during cancer treatment that no one really speaks about. And I suppose that, especially as a rugby player, your body's a huge part of what your sport is. That may be difficult. Yeah,
really difficult. Like I found that I probably had about like a lot of like the psychotherapy I had afterwards was about my body and how the relationship had changed. Like, you know, it's anything from, you know, the steroids I was having when I was having chemo. You know, I look back on the photos now and people call it moon face when you're having chemo. Your face honestly you just put on lots of weight and you just retain lots of, you know, it's a lot of water retention. So my face honestly looks completely different, like completely different. And, you know, even that I struggle to look at those photos. It just makes me really sad because I just know what I was going through. And at the time, the size of my face was not my biggest problem. I had a lot of other things to worry about. But I look at the photos now and it does make me a bit sad. And for a long time, looking at my scar, you know, it did make me sad. I just thought this scar is a physical representation of what I've been through and what's not there anymore. I found that really difficult because it is such a visceral image of what has physically been taken out of you. And I found that incredibly difficult to have something that wasn't there and that capacity wasn't there. So it took me a long time to sort of work on that, and now I'm not bothered. You want to see my scar? See my scar. You know, I'm not bothered about the type of bikini that I wear or people see it. You know, now I'm not bothered. And actually, I'm more proud of my recovery than anything. I'm proud of like the time that I took in the gym and the time I took to recover and look after my scar and go to the physio, and the time I dedicated to that was a huge, huge thing for me. So, yeah. I was actually, if you watched the angle of the camera on my face when I was hearing her speak then, I started smiling because it was so nice to hear the change in your mindset, and then to hear, obviously, this world we live in where social media is great, but it can also be the negative, where as women we compare a lot around how we look and how that makes us feel. And again, especially in sport, where the way you look matters, and that comparison, to then hear you got to say to you, like, I don't care, I'll wear whatever bikini I want. I love that for you, and I suppose that I don't think people really understand how powerful that is to have that kind of mindset. You've been through so much and it's so easy to probably be insecure about how you look and how you feel, but then to be like, nah, do you know what, I am strong as fuck. I've been through hell and I'm proud of I absolutely love that. I love that mindset. And like I said, my smile and I was hearing you going and I always just think, and I always say to the players that I coach now, and even you know, fellow players, I just say to myself, like, the way you speak about your body, you would never speak about someone else's body like that. So you'd never say, oh God, that scar's ugly. Oh, why have you got that out? Have you seen what bikini she's wearing? Oh, you never say to your mate, oh, do you remember when you put on weight during chemo? Oh, gross. You would never say that to someone else. And that's my mantra always through all of this, is just like, it's a be kind to yourself, but it goes beyond that in terms of just would never speak about someone else's body in the way that I talk about my own. And just, I like, we have a rule in our house, it's just the two of us. We have the rule in our house that we will never, ever, ever speak ill of our bodies in our home, ever. Like flat out. I just think like it's not part of the language, not part of the, how I want to be. So yeah, it's really important to talk and actually think about how much your body's been through, that it's been through so much, so much trauma, and that it's, be nice to it.
No, I suppose we are, and I hope it continues. I feel society is going through this body positivity change where the norm isn't having abs and being really small. It's more so being so inclusive where all bodies matter and how we look. Everyone's different. Like the four of us women are in, sorry Neil, the four of us, you can be included if you like. The four of us in here all look completely different, and that is so okay. Like you just said, we wouldn't sit here and be like, oh, you look different, you look you wouldn't do that. And I think now where we hope society continues to go is that we just don't care, and if you want to wear the goddamn bikini, goddamn wear the bikini. But myself included, and I've been nowhere near what you have, but as a woman you do have insecurities and you do have those doubts in your head how you feel. But like even myself, I've been going through it recently where I'm like, my body's changed quite a lot, and I'm like, oh God, I don't like what I look like in the mirror. But I've recently been on holiday and I was like, why do you care? Yeah. Why do you care? You're not looking at Susan lying on the lounger going, oh, because Susan, you don't care. So what? It's really difficult. But I think if we have more people like yourself being just so open and positive around, I've been through this, and I'm so proud of how my body looks. It makes me go, what the fuck am I got to worry about? Well, what am I stressing about? I have no right to be sitting here getting all insecure, And I'm radiating that off you. So, no, I'm
100%.
Yeah, I love that.
It's the same with screening, isn't it? Like people say, it's like people are really worried about attending screening with their bodies and stuff. And we say it a lot at work. It's like, no healthcare clinician, no colposcopist, no nurse is looking. Yeah, like every vagina looks different, every vulva looks different, every body looks different. And the last thing that nurses are focusing on is the way your body's looking in that moment.
But I'm not going to lie, when I had mine, I literally was like, oh, do I need to shave before I go? I need to be clean. I don't want to be, oh my God, I don't want to be traumatized, this woman. But like you said, think how many vaginas you must have seen over the years. And you're probably like, oh, it's just like having breakfast. In a week's time, you don't remember what breakfast you had. So I doubt that you're going to be remembering the 40 vaginas you've seen in one day.
Absolutely. I can categorically say not at all. We're there to look after you and treat you as, with respect and dignity, and as an individual, as we all are.
And I must say, when I had my screening, the nurse that I met made me feel so comfortable. I felt a little bit comfortable because I'd had a lot of endometriosis, invasive scans and stuff, so I was kind of a little bit more prepared for being exposed. However, I can understand how someone that may never have been in that position can be made really scary. Absolutely. So do you mind just giving an insight if people are listening that have never had a screening done, what the process would be when they turn up to meet somebody like you?
Yeah, absolutely. So of course we'll have a private room. You can bring somebody with you if you like. That's no problem whatsoever. We'll take you through the procedure itself in respect to explaining what the screening test is about, why we've invited you for screening, what we're going to be looking for. We'll go through some paperwork just to make sure the details on the form are correct. So of course when it hits the lab they can process it and send the results back to you. So we do a little bit of admin, so to speak. We'll go through the process, make sure you are happy, and give your consent. And it has to be informed consent because you have to know what the test is for and why you've been invited for that test. We'll ask you to undress, so the lower half, so your underwear, trouser skirt off, so lower half off, and we'll give you what we call a dignity sheet. I call it the NHS special because it's literally just a little sheet that is popped across your lap. And remember, you're in control. As that person having that screening test, you're in control. We can stop at any point. The equipment that we use, so we call it a speculum, they're like a pair of shoes actually. So not one size fits all. So if one is not comfortable, we can change it to another. Remember, you're in charge and we're guided by you, so we'll ensure that you're relaxed, you're comfortable to go ahead. Once we've passed the speculum, we have to visualise the cervix. We have to give the cervix the health check through the naked eye initially, and we take that sample then using a soft brush. I've actually got one with me if you'd like to see one.
Yes, get it out. Okay.
Whoa!
Zoom in.
This is the brush that is used. And I'll pass it round to you now, guys, but have a feel of that and have a feel and tell me what you think.
Yeah, it's a lot softer than I thought it was.
Yeah.
I thought it was, wow.
It's
And
a lot
that's
softer.
that's the boy. That's the
That's exactly what's used.
Whoa, it's like, yeah, it is soft.
Isn't it?
Yeah. So
Whoa.
quite often a common...
You go in and you
Yeah,
do a little
so go
spin.
in. So the cervix, thank you, is the head of the womb, the neck of the womb. So that's what we're looking for. So we locate the cervix. We take that sample, as we looked at, using that brush. And then the sample that's taken on that brush is transferred into a pot. And then that gets sent off to the lab. And literally a common thing that's said after the test has been taken, is that it?
Yeah.
That's quick. Was that that was just like a tickle, and these are the common things that we are often told, you know, and then that's the procedure done. And then, of course, we'll write you with your results. They take between 4 to 6 weeks, and so your results will be sent to your home address. And as we touched upon very earlier on, that how you were informed of your results, you'll have a letter and you'll have a leaflet to outline what the results mean as well. Any questions, don't hesitate. There will be telephone numbers on that information leaflet and letter. Get in touch with us at Cervical Screening if you have any questions whatsoever. You're not on your own.
And just briefly before we wrap up, what you both think needs to change on how we speak about cervical screening?
I think it needs to become the norm almost, because we've, females have cervixes, they're there. We need to look after. Just because you can't see it doesn't mean that, there's no changes going on there. So it's really important that you do go for your test. All of us in this room are advocates for cervical screening for a reason, you know, and the bottom line is, again, it could save your life.
Yeah, I echo that, and especially I think for young women, I'm just super passionate about younger women attending screening, because it is a thing that, there is a misconception perhaps that it is only for, women in midlife, and it absolutely isn't. It can, and I think it's really clear from my story that it can happen at any time, and that's not in any way a scaremonger, that it does happen to you at any time. It doesn't discriminate. We hear that all the time, and that as a young woman, if you have it and you've got no HPV, or you've got no high risk, unbelievable, amazing, and we just continue that as a habit. It's just like a regular habit of having your MOT. So that's why I still call it.
Well, you wouldn't miss it on your car, couldn't we?
Exactly.
That's true.
If quickly then, Carys, if you had your smear done and then you had no HPV, when would you need the next one?
Okay, so like I say, the test is done, sent away to the lab, HPV negative, that is where the test ends, and we'll ask you to come back in 5 years' time. And it's very, very safe to have with a HPV negative test. It's very important that you attend in 5 years' time, and it is safe. I know it sounds a long time, but the research and evidence supports that, of course, you need HPV for the cell changes to occur in the first place, but having a HPV negative result is very reassuring, because the research has found, looking at what we call disease progression, so that's from infection of HPV to it actually causing the end point, which is ultimately cervical cancer, that progression takes around 15 to 20 years. Whoa. So that's why it's safe to have a 5-yearly interval. However, if you do have any of the symptoms that we outlined, please don't hesitate but to go to the GP.
Yeah. So if, for example, you had a HP negative result in a few months, say 4 or 5 months after, then you started to experience symptoms, then you'd go back, and then that might have changed, but at least then, just because your test results were negative initially, but then you then develop symptoms, then you'd recommend people going back.
Definitely. So they wouldn't obviously do a screening test at that point. It wouldn't be appropriate anyway, because it's not designed for investigation purposes. However, it's very important that you go. There'll be alternative investigations that they could be looking into.
Perfect. Thank you. Right. Well, we have a closing tradition on the podcast where the previous guest leaves the next guest a question, but they don't know who they're leaving it for.
Oh.
And I actually quite like this question, considering the topic we've discussed. What's your favourite thing about yourself?
What a good question.
Isn't it? Carys?
Yeah, I like that. We didn't know this was coming up.
No,
we didn't know.
No, we didn't.
And
the people that left it didn't know that you guys are going to be answering
exactly. So how fitting is that? Okay, I'd say my hair.
Lovely. It was lovely. She got lovely long blonde hair.
Thank you. But yeah, spreading the positivity.
Yeah, you do give golden retriever energy. I will give you that.
Oh, lovely.
We did have a guest earlier on this who gives golden retriever energy, where it's positive, always smiley, just like really bubbly, and you are. That's a compliment, by the way.
Thank you very much.
So I would definitely say that your personality does shine.
Oh, thank you. It's really, really thoughtful to say.
G?
I would say physical and mental strength.
Yes.
Yeah, I'd say that's my
that.
definition.
Yeah, definitely, I agree.
Definitely.
Thank you so much for joining me on this episode. It's been
More than
I've
welcome.
learned so much, and I knew I would, because there's still so much I was not aware of regarding this. Obviously, Carys, you do so much in this field to try and spread awareness and help so many different women, and like you said yourself, an advocate for female and women's health. And then, G, everything you've been through and being so open, but having such this strong mindset now is incredible. And like I said, I was smiling when I was listening to you earlier, how you were saying how you view your body now. For me, that was a perspective change, because I was like, I need to not care too. If this girl has been through this much and she can be this positive, then so can I. So I've taken so much from this episode, and I know so many people that will listen to this will too. So thank you so much for your time. Massively respect everything you're doing to try and spread awareness and try and help so many different women.
Thanks for having us.
Thank you.
Thank you. And remember to keep saying it how it is.